I filmed this because I don't know if other people are experiencing pain and don't know why. Maybe it's helpful for someone who knows. Uh, Pascal is all ears. So, one thing I'm supposed to do every day is ankle cars or controlled articular rotations. It's putting the joint through the largest range of motion that you can without insulting the tissue, feeling pain, gritting your teeth, and having your eyes pop out of your head. Since I have a lot of ankle pain, I do want to try to increase the range of motion. I have a lot of ankle pain and my dorsiflexion, this angle is severely limited. I can plantar flex fairly well, minimal pain with this tendon, but the dorsiflexion is, I'm not even sure if I really can get perpendicular. It's essentially negative dorsiflexion capability, active. I can stand and passively get myself into further dorsiflexion. So with the ankle car, I'm going around. If my ankle was a clock, say this was noon, this angle is 11, this angle is 1, down here is 5 o'clock, down here is like 7, 8. Traversing from 11 to 1, going towards inversion, is the most painful. There's a lot of clicking. This tendon gets angry. Something under here gets angry. Then going the opposite direction is also pretty painful, but not as bad. So what I'm supposed to do is really try to feel the closing side muscles working, trying to go as far as I can and trying to gain more real estate. I've had conflicting opinions about this. Some say that if the pain is at about a 3 out of 10, then it's inevitable with my pain history. Others say, no, any pain is going to flare up the nervous system. I don't do these as much as I should because, one, I'll get into a pain point and then I'll obsessively stay there. And of course, it continuously hurts, but my brain is telling me if I just stick with the problem area, I will fix it. It's like the opposite of dusting under the rug. It's like you're hurting and I'm going to fix you right now, which isn't great, of course. Another reason is that sometimes it just hurts and I don't want to deal with it, but also the psychological impact of something is really messed up. No one is really telling me why, if it can get better, and I don't want to confront it. It feels like something is so deeply wrong with me. And yeah, that's when I then think I need to just get it amputated because I can't have this dysfunctional, mysterious thing attached to me. Mysterious sounds like too positive of a connotation or neutral. It's just like something is really messed up and no one wants that attached to them. So I go around. It feels a little better today, maybe, although this corner is just the nightmare area. Trying, feel a very intense stretch under my knee and calf. Honestly, that's the brightest sensation right now. So there was a clicking there. This tendon seems to be very aggressive. It's always trying to help out. So there's a lot going on just with this movement for me, nervous system wise, mentally. I also want to interject and say that when therapists who do cars talk about it, they say, oh, it's a way to scan to see if there are problem areas. So with the shoulder, they love doing the shoulder because it's, I don't know, they're like, okay, you're going, oh, it's pinching. Okay, it's pinching here. That's great information. Pascal continues to soak it up. So scanning, okay, there's the problem area. Well, it's not so clearly demarcated for me, whether that's because the nervous system, the feedback is just so blurred, my brain's cut off that part. who knows what, is so used to having bad messages that when I'm trying to build this map and figure the line of here's pain, here's not pain, for one, sometimes my tendons just pull me quickly over. I'll be going along steady, steady, and then it's literally like a riptide pulling me over where I can't control it. So then it's like I can't even get anywhere near, so I'm not extending my real estate because I can't even get into the ambiguous area because something's literally pulling me over. Like the click, it's like gravity.